Utility is often measured using a short questionnaire. This questionnaire presents respondents with various dimensions of health and asks them to indicate which of a series of statements best describes them. Since there are a finite number of ways to respond to such a questionnaire, the questionnaire allows us to classify people into health states. So, for example, if an instrument had 2 dimensions and 2 possible response levels, there would be 4 possible responses, that is, 4 possible health states. There is then a predefined algorithm that assigns health utilities to each health state. You can also think of this as taking the health state and looking up its utility in a table. Of course, in practice, questionnaires are much more detailed and capture many more health states, hundreds, thousands, and in some cases millions. So that's how we measure utility, but where did those numbers in the tables come from? These numbers come from a valuation study. In this study, members of the general public are invited to participate and are led through a series of tasks that help them to express their utilities for specific health states. We can then compute mean utilities for the health states. However, since we don't capture all the health states in the valuation study, rather than using the observed means in the data, we do some statistical modeling, specifically regression modeling. Here, mean utility is expressed as a linear function of the attributes of the health states. This allows us to make predictions about health states for which we did not collect data. This modeling introduces some uncertainty, both in the slope of the line and because the mean utilities do not lie exactly on the line. This uncertainty means that while we can predict a specific number for the mean utility, we must also be honest about how accurate the prediction is. Typically, we can be 95% confident that the value lies within plus or minus 0.06 of the mean. This is a considerable amount of uncertainty. Generally speaking, a change of 0.07 or more in mean utility has an important effect on patients' lives. Since health utilities are used in calculating quality-adjusted life years, but we're uncertain about the values of the health utilities, this contributes additional uncertainty about the cost per quality-adjusted life year. This uncertainty is currently ignored in economic evaluations. So to sum up, health utilities are estimated subject to considerable uncertainty, and this needs to be accounted for when estimating the uncertainty in the cost per quality-adjusted life year. Communicating uncertainty accurately to decision makers is necessary for reimbursement recommendations to reflect the scientific evidence.